Good afternoon to all. Respected my Guruji Andreya Murthy Garu, Madam Murthy Garu, senior faculty from Bellary, and the Arjuna of the Ayurveda Kaushalam, Dr. Sundarraj Perumalji of Ayurveda, lovers of Ayurveda, young torchbearers of Ayurveda, really. I am here, Dr. Suchita from Hyderabad, a Shalakya consultant. Dr. Satyanarayana, behind Dr. Sundarraj Perumalji, the man, everything behind Sundarraj Perumalji. And I am delighted to be with you. And one thing what I would like to tell you is, I missed my promise last session, last year. I wanted to come as a speaker, and somehow it happened for me. I missed, and I promised Dr. Ji, I will be coming this time definitely. I am delighted to be with you, with the environment and asrama environment. And my dear friends, I would like to start with the Susrita's leaf therapy, a blessing in disguise for patients of burgers and general phenomena. I would like to tell you. Before going to the topic, Ayurveda is a science and art of dynamic state of living, is able to cater the needs of the society since time immemorial. Time immemorial, the fundamental, philosophical, conceptual renaissance of the science made a clinical entity and to flourish till time immemorial to the present arena is the greatness of Ayurveda. The fundamental, philosophical aspects of any particular science, specifically Ayurveda, is just because of its clinical entity. As Sir was telling, theory and practicals are the two chakras of a radha. If you have theory, if you are unable to produce practicality, there is no meaning in it. So both the thing, balancing theory and practicals and going forward is makes you people, you younger generation, to flourish in the system of practice. And coming to the leaf therapy, this comes under Rakta Mokshana, we will discuss again. A wonderful, totally neglected part of Ayurveda. Because we have done some interesting zones in the leaf therapy, because leaf therapy can be used for the non-healing ulcers, varicose veins, varicocele, diabetic foot, eczema conditions, and whatnot. Wherever the medicine doesn't work, we definitely take the leash there, and all the pitta prakopa disorders, we start using leaf therapy. And people will laugh at us. Some modern surgeons, even last week, one of my students from Vijayawada sent me a clip. One doctor, one super specialist was talking on the varicocele management, leaf therapy, taking the impure blood from the system. He is a modern doctor, he was talking on that, because I wanted to tell you that. Taking impure blood, these Ayurvedic doctors use the leeches just to take the impure blood. He was criticizing in such a way how a leech will take impure blood. What is impure blood in the blood? And a man who is ignorant of Ayurveda and a super specialty part of leech therapy, this is super specialty part of Ayurveda, without knowing the basic tenets and fundamentals of science, criticizing is detrimental to his own existence. And I have immediately messaged to that student, please carry forward my message to that super specialist. What is leech therapy? We will discuss that part of what exactly the leech therapy is. My dear students, Dhanvantri, he holds Shankachakra and Amruta and leeches in one hand. That is the significance of holding leeches. See, 4 hands, one hand he has given a priority to hold the leeches, how meticulously they are used, how effective they are in the management of therapeutic corner. That signifies this leech therapy. Leech of, it's a medicine. For your information, the dimension of leech therapy is out of our boundaries. Now, neurosurgeons are using, cardiologists are using, vascular surgeons are using, and the entire dimension, and it is a added boon to the Ayurvedic surgeons, Ayurvedic practitioners to use the leech therapy. This is signifies the Susruta's conduction of surgery or leech therapy, parasurgical procedure. Anyhow, this is signifies how surgery was being practiced in that tenure. Well, this is one important picture I could able to collect from the Australian Museum. My dear friends, this was Hans von Goltzaroff Field Book of Wound Medicine 1517. In the 15th century, there were points to practice leech therapy. Where exactly, what are the sites can be practiced. So this shows, this symbolizes the significance of leech therapy in that particular period. And ancient Greek painting showing a physician how he was bleeding from the patient, how he is performing Sira Vedana in the patient. And this is one of the 1693 picture diagrammed transfusion of sheep's blood in an emergency. Transfusion of sheep's blood was conducted in the tenure, and it may be definitely a dilemmatic, doubtful and unscientific until unless it is established. In an emergency, those days, with the permission of the kingdom, they were practicing the sheep's transfusion. And what were the precautions being practiced to transfuse the sheep's blood is immaterial at this juncture. And this is very interesting for Ayurvedic people, bloodletting and astrology. Who is Gemini, who is Tulasi, who is different rasis will be there, and particular rasis or maybe and different zones of areas of practicing for the astrology has a say in the bloodletting. This is a different work, and probably Murthy Garu will answer for this. Well, this is another interesting, this is a Hakim Iqbal in the Delhi Chandni Chowk Road. Still today his family practices daily. More than 40 to 100 people on the road, they do come for their problem, for different chronic ailments. They do come, and he will be doing simple, taking a Bharat blade or a blade available and simply washing with the betadine solution, making multiple puncture and allows the blood to flow, and ask them to wait for a while, and they pay 50, 100, whatever they feel like, depending upon the relief. It is being still on today. It is in practice in the Delhi. See how the people are waiting on the Delhi roads. What I would like to tell you is, he is not a qualified. He is a quack. But the thing is, when it comes to the practice, when he is able to produce the positive results, good results, people will come to Delhi, Anakapalli, Vizag, wherever you are. The only thing is you should be in a position to give proper, appropriate relief to the patient's ailment. This is the area where he is practicing. And before going to the session, total surgery can be divided for undergraduates, for the practitioner's purpose, parasurgical aspects, surgical methods, and super specialty methods. And parasurgical, you know it, Kshara Karma, Agni Karma, and surgical methods are Ashtavida, Shastra Karmas. And I consider being in the field of Shalya Tantra. I am a surgeon basically. I am a general surgeon We 30 years back, we started doing hernioplasties, herniorrhaphies, hydroseals, circumcisions. Later, Tirupati College, we have developed from the zero to we made the institution proud, and being working there under the Lord Balaji is always a blessing for us. And this I consider Raktamokshana super specialty aspect, and Raktamokshana definitely comes under super specialty. Plastic surgery is also one of the signs. And Raktamokshana, if it comes, you know it very well, non-invasive and invasive. Invasive, where you do prachana, siravedana, these things, and non-invasive techniques. What are the non-invasive techniques? Shrunga, Jaluka, Alabhu, and Ghati. Well, these are the therapies, and today we will discuss the least therapy here. And one of the picture, Siravedana. Siravedam chikitchardam api sampurnam. Chikichitam. Siravedam, if you are able to perform the Raktamokshana, half of the chikitsa is done. Like Vasti, Sarvam api chikitsam Vastim eke. Like that, Siravedana, if you are thorough with that, you know half of the treatment modalities in Susruta Samhita. And Shrunga, there are different specialists. We have done basic works on Shrunga, Alabhu, and for Vata Prakopas, Pitta Prakopas, and Kapha Prakopas, taking the dosha variances, practicing these things, we will come for Prachana, and Siravedana is also bloodletting. The dimension of Siravedana has changed. If you have a case, I will show you how to Siravedana modality. And this is how Alabhu practice using bottle gourd. See, it is just like the principles of Bell's George's philosophy. This is the original photograph of bloodletting. Actually, if it is, for example, on the scalp, clean it, take all aseptic precautions, making multiple punctures on the lesion, keeping the wider part of the Shrunga on the lesion, and suck with the mouth. This is the actually original picture. Yes, effect of Raktamokshana. And the controversy starts with the Susruta philosophy and Charaka philosophy. Can you consider Rakta as a dosha? Now there is no controversy. Rakta is a Chaturdha dosha. There are clear-cut discussions on that. We will go for it. And Rakta as a vehicle, the blood being the vehicle to carry and transport absorbed nutrients and oxygen, metabolites from place to place. And a miraculous effect is those who get Raktamokshana regularly, routinely, never suffer from Tvak doshas, Grandhi doshas, Shofa and Rakta rogas, and and no dermatological manifestation will occur. And this is the reason for the young incumbents, young practitioners, torchbearers of the Ayurveda. You can, in the practice, if you can convince your students to go for the bloodletting therapy regularly once in a month, either depending upon their dosha's provocation, and probably we have observed the lipomas, cystic disorders, dermoid conditions, dermatological manifestations. You may find your patients, especially frequent recurrences of eczematic conditions, frequent conditions of phlebitis, thrombophlebitis, and these dermatological manifestations can be averted with the regular practice of Raktamokshana. Raktamokshana, whether you do leash, whether you do Siravedana, whether you do Prachana, whatever, it depends upon the doshic manifestation. And there is one interesting, before really conclude, to talk on the release therapy, Raktamokshana as a substitute to Panchakarma. This is highly controversy. There is no controversy. Panchakarmas, the highly efficacious procedures in eliminating the endotoxins from the body. But why Raktamokshana is alternative or superior? If Panchakarmas, if you are not in a position to perform on different contraindications, if you can execute Raktamokshana, it could become the substitute for the Panchakarmas also. And the role of Rakta Mokshana, it's very clear. There are specific indications. Tvagdosha, Grandaya, Shofaroga, Shonitajascha. Rakta Moksha Sheelanam Nabhavanti Kadachana. It is a clear set of indication. And these set of indications, Tvagdosha and dermatologists, highly demanding MD dermatology present day, dominating radiology, general surgery, is because there are so many autoimmune disorders, dermatological manifestations, eczematic conditions, different autoimmune manifestations which never respond to any drug, including steroids, and finally they bounce back to Ayurvedic people, and you have a say, you have a role in treating all these manifestations related to Tvagdosha and Grandaya. These are the cystic manifestations. Like cystic, I don't know how many people you have seen, they witnessed the sebaceous cyst, dermoid cyst, lipomatous cyst, and neurofibromatosis. And if you can give medicine, it's okay, but trying with Rakta Mokshana could benefit a lot with your patient. And Shofarogas, edematous conditions, non-specific edematous, any non-specific edematous, and you can try very safely, and all the Shonijascha, and which if you can diagnose Rakta as a predominant Vikara, please blindly you can practice Rakta Mokshana. Yes, supremacy of Siraveda, and immediately you can ask me, can control all the doshas? It can, because it is said to be Pitta and Rakta Vikaras, and definitely the reason behind is that the therapy which will help you, elimination of all the three doshas, because will definitely help you in maintaining the Raktaja Vikaras. A substitute for Panchakarma, as I told you, definitely in a patient, geriatric patient, in a cardiac patient, in a debilitated patient where you cannot do the Panchakarmas, there if you can practice least Rakta Mokshana therapy would give wonderful results. And indications for, you should be very careful, and blindly people have seen different students, different practitioners. For every disorder, they select the leeches since available. They do perform Prachana simply, and they do perform Siravedana. There are a specific set of indications for leech therapy, for Siravedana, for Prachana, for all these things. You have to only classify them, and if you can judiciously classify them, you will encounter with the good results. And these skin disorders, like I told you, inflammation, cellulitis, erysipelas, Vidradi, even abscess conditions, and leprosy disorders, anemic also, and these all the, even hypertension, I think you can try. It is an interesting aspect. You can try young generations, hypertensive patients with Siravedana. And because when you do the Siravedana, blood, pressure will come down. And the reason regular practice may bring down, we have to see, and the eczema, psoriasis, obesity, toxemia, vascular disorders, non-healing, and failure. The people were, when I started my career 3 decades back, 4 decades back, talking to the people on the vascular disorders, and only the thing is Rakta Mokshana is indicated for the varicose veins. And the dimension has changed now. Even cardiologists, they are practicing. Vascular surgeons, they are practicing. And for your information, FDA of USA has approved doing leech therapy in the vascular triple vessel blocks. The principal changes in the complex system due to the blood-letting therapy. What happens? It is really a dilemma. It is a wonderful thing, really, how we can counter the modern, especially modern, and even in our circle also, to answer the modality of action of Rakta Mokshana is a controversy. But when you practice thoroughly, you can counter them. The diminution of the mass of the blood, by which the overload of capillary or larger vessels is relieved. The certain amount of capillary pressure will be relieved. Once you apply leech therapy, once you do the Siravedana, around 50 to 100 ml of blood will be removed. And suddenly the system of hemopoietic system, it encounters the loss of the blood and it triggers hemopoiesis, one of the factor. The force and frequency of the Hertz action is modified. This looks to be very simple. The Hertz action modification can trigger producing various biochemical changes in the phenomena and a change in the composition of the blood, rendering it less stimulating, the proportion of serum becoming increased after bleeding, the consequence of it being reproduced with a greater facility than the other elements. We were, for postgraduate students in the college, a decade back earlier, we have given a work. Everybody will practice the leech therapy. And we never bothers, it is giving relief every week, 10 weeks, 15 weeks, 5 weeks we give. We have given a study to our students. Why can't we study? People will contrarily think about us. The suctioned blood from the leech, collected carefully, sent to the pathological lab, and what exactly the previously patient was given his blood, and the blood which was sucked from the leech was given to the evaluation. For your information, the 2-3 things, very interesting thing. One is the HB concentration is increased, RBC number is increased, WBC number is increased, serum levels have come down. These are the things which have to be studied further. The role of the leech therapy in the hemopoiesis, the role of leech therapy, how it could encounter in pacifying the different manifestations. We will discuss again how exactly the leech therapy will have a say in that. This is one of the interesting leeching Egyptian tomb, how they were practicing. And these are the simple material in the practice, in the general practice. Anybody BMS qualification can practice, but keeping these things like cotton, turmeric powder, Triphala Kashaya, and Dhurva Gruta, Saindava Lavana, Jaluka, keep them ready. And the specific set of indications for leech therapy, one is pathological wise, humorally, disease wise, and persons wise. Pathologically, Hastamatrantu pramanena. This is very specifically indicated for leech therapy. The lesions affected with the Hastamatrantu. These Hastamatra pramanena lesions can be easily taken. For one example, you tell me, atopic dermatitis, venous ulcer cases on the medial side where the varicose veins are there. And this Hastamatrantu pramanena, be careful. And humorally, Pittaja Raktaja Vikaras are definitely good indication, but all the Tridosha Vikaras you can take into the practice. And specifically there are cellulitis, hemorrhoids, cystic growth, abscess and varicose veins. And for your information, and we are working on varicocele. What is the difference between varicose veins and varicocele? Yeah, you are almost nearer. Varicose veins are dilated, tortuous, engorged condition of the varicose veins which are present medial side and lateral side. Varicocele, as you said, madam, it is the, as you said, dilatation of the pampiniform plexus of the testicular veins. And this is a major problem in the younger generation, predisposing for the oligospermia, zoospermia. For your information, now 50% of my revenue is on leech therapy and varicocele. Yes, madam. It started 10-15 years back. We just like that we started doing. People are every week in our hospital. We conduct a leech mela on 10 to 15 patients. Every week leech mela. We call it as, we have 3-4 students and all 5 staff will be coming leech mela, and majority of them are varicocele. I don't know, in the practice, in the due course of practice, you can change the dimension. Varicocele, now they are successful. I'll show you one of the patients' reply on this. And the pampiniform plexus of testicular veins, the dilatation, it is 3rd or 4th grade are definitely indicated for surgery, varicocelectomy by any general surgeon or urologist. My dear friends, you can confidently practice varicocele cases without varicocelectomy. without referring to general surgeon or urologist. Just simple mere, but you should be careful in handling on the testis, on the scrotum, the upper part. Usage of leech therapy, 1 or 2 leeches on the upper part of the testis, where pampiniform plexus veins are there, and be carefully, be judiciously, and without penetrating into the other urethra and other things, you should be very careful. The dimension, if it comes on the practice, you can change the dimension. Sira Grandhi Vikaras, this is the dimension which is there, the indication is very much. And also weak Krusha Durbhala Birunam. Timid persons, weak personalities, definitely we can go for the application. And this is how leech therapy, pre-leech therapy, you know it, collection of the leeches. Wait for 1 week, very simple, don't see this. And once you collect the ponds leeches and collect them from the collectors, you have to pay 300 to 400 rupees each leech. It is now costly affair for any practitioner. So Dr. Suchita was telling collection of the leech is very tough, and even getting, we pay sometimes 500,000 also. But depending upon the demand, if you don't get. And there are cultivators now started, Muzaffarabad, Hyderabad, Manipal, and North Indian. There are 2 or 3 centers who are cultivating and exporting leeches to the different parts of India and abroad. And these leeches, and don't use pediatric leeches. Take adult leeches, young leeches, and once you collect from the pond, keep them in the any pond water, and don't use for 10 days. Leave it like that. And some whatever the leaf grassy material you can insert. After 10 days you can select the leeches, honey color, which are active, and just you can start using. Collection, activation purpose. Once 10 days, 15 days is over, keep the leeches in the tray and put the some turmeric powder, where immediately they start moving, and select them properly, which are very active and hunger. And naturally, preparation of the spot, that is very important. And as you, because preparation of the spot in surgery, you go for the just wash with betadine spirit. No, you will be doing a blunder. And once you wash with betadine and spirit, the leeches never hold them properly. They reject. They are not, no, they don't like that smell. So wash with water properly and keep them safe. And that is enough. Sometimes Haridra powder, okay. Well, so once it is collected and the disease is selected, and like any of the indication, keep the leech. And I tell you, I make a joke, and never force the leech to apply. Never force the leech. And you know, they are very intelligent leeches. Never force, taking the leech, keeping on the lesion, covering with the cotton swab, pouring the water continuously, that is okay. But if it is in the case of the lower limb and upper limb, cool, very cool. Keep the leg in the bucket, leave the leeches, and they know where to suck. But the problem should be related with the lower limb or upper limb. Don't worry. And don't be very particular. Let them hold on the venous ulcer. के ऊपर रखने दो, अबे उधर ही पकड़ने दो. नहीं. It's not like that. You don't bother about it. Any lesion within 6 inches periphery will have the same impact. If they can hold on the diabetic foot, if they can hold on venous ulcer, if they can hold on, but only certain conditions like varicocele, it is in this much of scrotum and this much is the area where you have to struggle. Keep the leeches, active leeches, put them and cover the cotton swab, continuously pour immediately within 1 to 2 minutes, it will start sucking. Your job is over, a very simple job, and never struggle. And the only thing is, yes, how to identify the leech, because it will take 20 to 30 minutes, that job is. And after 30 minutes, you could take the turmeric powder, keep it on the mouth, and immediately it will leave. Or otherwise some salt or tobacco powder, whatever it is available. Turmeric is everywhere we get it. Just pinch of turmeric on the mouth, it will leave. But sometimes you'll find the leeches which are very greedy, because maybe they are hungry, we don't know. They don't even leave the area even after keeping turmeric or tobacco. So then just move them and keep them, separate them to another tray. It happens. And one important thing is, one is the leeches. Why, you may question me. One is the process of leech therapy, application, suction process. Samyak Jalukavacharana is over. Why we should conduct the Vamana Karma? Because we have read if we don't do Vamana Karma to the leeches, they do develop a Indra Mada Vyadhi. They do, definitely. But this is a fact, this is the truth. Once, if you don't perform the Vamana Karma on the leeches within 1 or 2 days with the over, they may die or they may not ask for food for 6 months to 9 months. The gut which has sucked the blood full enough, a leech can stay for more than 6 months without asking for food, and they do go for hibernation. Somewhere into the pond it will go, and for 6 months it won't come. It doesn't require. The only thing is we human beings, every time we make the time and eat unnecessarily. No, you ask tiger, lion, they never, once it is food is over for 1 month, they do never hunt anybody. The only leeches also like that if it is full. But the problem is, because we have to, our selfishness, we have to perform the Vamana Karma and reuse the leeches. Well, this is a work we have done from the institution, from our poster, where exactly the Rakta Mokshana is indicated. We have done different set of, from Broth rice, Lagut rice, we have done, see, these are the indications where leech therapy can be practiced. Padadaha, Harsha, Kanja, Fangu, Vata Vedanas, and like that, Parsha Shulas, and wonderful set of indications. Take one indication which is not amenable by the modern surgeons, physicians, then you can start doing. And we have collected around 77 diseases from Broth rice and Lagut rice to practice leech therapy. We have done a 3 months work on this, where exactly people will speak lot. This area, they say, there are so many areas, like 77 indications, where a set of indications are there. You can safely, confidently, you can practice. But generally to speak, we speak general disease indications. Yes, as I told you, USA approval for leaching, exporting, importing, and usage for the cardiac purposes is approved by the USA FDA approved. And Royal College British system officially accepted using. If anybody wants to go to Australia or Europe or America and safely, because leech therapy, there is a certificate course in the Europe, there is a certificate course in the Australia for the leech therapy, and once you get that certificate, you can safely practice. And now we think we are feeling shortage. 17th century may be shortage hai. People, because it was very heavily used in the 17th century, and even scarcity of leeches was also found in the history. This is the data I am giving, how it was vehemently practiced in the 17th century. Well, bloodletting, a life-saving measure. Very important thing I would like to tell you. There are few conditions, not for Ayurvedic people, even for modern surgeons, modern physicians, without bloodletting. Now, even today, if you don't practice bloodletting, people will die. Even modern physicians, senior physicians, will advise bloodletting, phlebotomy to the patients. Anybody, one disease, anybody claim. Even now, any senior, any MD general physicians you ask, they will tell you there are 3 diseases. That is, one is hemochromatosis. Second thing is polycythemia vera. Third one is porphyria cutanea tarda. Even today, the modern physicians has to practice venous section phlebotomy, either by means of leech therapy or venous section phlebotomy. Invariably, they have to practice. The first condition is hemochromatosis, is a condition, autoimmune disorder, where there will be excessive deposit of iron in the organs. Excessive iron, if it is deposited in the liver, in the kidney, in the spleen, and what happens? Multi-organ failure, and they will die. This is one of the autoimmune disorder. And polycythemia vera, the production of RBC from the bone marrow, it happens, we don't know the genetical deformity. There will be uncontrolled production of WBC, RBC and other cells by the bone marrow. So this is uncontrolled production of WBC, RBC, overload the vascular system and collapse. Patient will suddenly collapse and die within few months. And there is a porphyria cutanea tarda, a condition. This is one of the dangerous condition. In the biosynthesis hemopoietic system, there is an enzyme which is called as porphyrin. if it is not being produced in the system, it will lead, once the patient goes outside, a simple sun ray falls on the body, he develops severe rashes on the body. It becomes a disease which is also called as known as vampire disease. Saitan ka vyadi, vampire disease. Such a dangerous thing, because of the malproduction of porphyrin, interferes with the mal synthesis of certain enzymes, causes hyperreaction of the skin when he goes outside. In these three conditions, bloodletting for anybody, Ayurvedic or allopathic people, and they have mandatorily practice natural blood bleeding in the females, and leeches are eco-friendly. Yes, the principle of naturally beneficial relationship with leeches, a symbolic relationship is there with the leeches. And one interesting thing is symbiont bacteria, because there is a bacteria in the gut, Erymonas hydrophilia, a bacteria which will be there in the gut of the leech. This does simultaneous biosynthesis of the blood, releases certain enzymes. And what I would like to tell you, my dear young practitioners or the practitioners, the dimension of leech therapy is not the taking out the impure blood. It is not the taking out some amount of blood which triggers the hemopoietic system. Leeches are such a intelligent creatures on the body, on the globe, earth. They have a specific set of neurosensors. They identify the disease pathology. Countering the existing disease pathology wherever you practice, releases certain proteolytic enzymes up to date. Today, if you refer any Google search, more than 120 proteolytic enzymes have been documented with the secretions of the saliva. These 120, what we talk, antiseptic, analgesic, anti-inflammatory, and anti-protozoal, this and that. But these leeches are very intelligent, countering the existing pathology. They releases the proteolytic enzymes. The disease modification which will be done by the secretions of the leeches is the success behind the philosophy of the leech therapy. And also, the gut which contains Erymonas hydrophilia, which is a symbiosis action. Whatever the impure blood or blood which sucks from the lesion, from the eczema lesion it has sucked, and the biosynthesis Erymonas species will counter and dilute the toxins, whatever it has sucked, and helps the leech to survive itself also. This is discovery of leeches, neurons, a triumph of natures. This is very interesting. The work was done by the modern neurologists. A new scientific discovery was the leech neurons. When integrated to the computer, circuits were capable of doing simple arithmetic calculations the central nervous system of the leech is able to do. The testing procedures themselves presented the principal's limitation on those results. More amazing results are to be expected in the future. Is this to be seen as a triumph of nature of the technology? This is how I confidently speak. The neuron system which is present in the leeches are capable to identify the disease pathogenesis mode and contrarily able to produce the disease nullifying enzymes. This is Burger's disease, you know, one of my work which was done in the department. Burger's disease, entamandi winner, how many people Burger's, thromboangiitis obliterans, very common disease. Kanisam 6 months lono, 3 months lono oka case. Roju manam chudakapoyina 2-3 months lo oka case manam we are able to see this case, very interesting case. And they must be heavily only BD smokers or cigarette smokers, 100%. Without smoking habit, they never be, diagnosis cannot be made. See, you can see this picture. He is habituated to the smoking, fingers gangrene, still unable to stop. No. Cigarette tan on the fingers. See, such a heavily, some years together practice, smoking practice. No, never he leaves. And Burger's disease, is a thromboangiitis obliterans affected with the small and medium-sized arteries in the lower limb, may also affect the upper limb, and it diminishes, converts into PAD, and there will be clots will be formed into the lumen, and they obstruct the lumen, the supply will be diminished, and naturally, and it becomes gangrene. For a modern surgeon, they try with all varieties of drugs. Finally, they post them for amputation. Thromboangiitis obliterans can be relatively uncommon occlusive disorder. Small and medium-sized arteries, distal upper and lower limbs are the most affected part, and typically identified in young adult men who smoke. You can see this gangrene. And in such a condition, if you start doing, if it is referred to a surgeon, he tries to remove. And if it comes to Ayurvedic surgeon, do leech therapy and patient will recover. This is one simple diagnostic. No, we can walk for 100 meters safely. Patient is unable to walk for 1 or 2 meters and getting pain can be diagnosed thromboangiitis obliterans. This is a claudication distance we call. And pain may be ischemic type, sensitive to cold, and diminished pulses. When you see the pulse, dorsal speed is anterior tibial, posterior tibial, and the pulses will be diminished. You are unable to identify the pulses in the lower limb or upper limb. And ulcerations, rather, once the supply is diminished naturally, ulceration, gangrene. Management in the modern prevent progression of the disease, avoid vasoconstriction, and promote vasodilatation, and relieving pain. And any modern physician or surgeon, they do give vasodilatation, avoid vasoconstriction, and prevent progression, heat therapy, this and that, and treat ulcer and gangrene. And finally, if it doesn't respond, this is the arteriography. When you see a classical patients in the upper limb, if you see the arteriography, you can see the carpal, up to the carpal, the radial artery supply, and remaining metacarpals and tarsals, phalanges have diminished. Only up to the levels of carpals, you can see the blood supply, radial artery supply. Now it is over, and these cases very dangerous. And can this disease be compared to Sira Grandhi Shaithilya or Sira Grandhi Dhamani Vikara? There is a reference in the Ashtanga Sangraha, we can come. The dosha is three doshas. Doshya is Rakta, Srotas is Raktavaha, Adhisthana Adogami, and Sroto Dushti Prakara is absolutely Sangha, claudication, thrombus formation in the vascular system. And Rogamarga is Shaka, Strita, Bahya Rogamargas. Sanchara Sthana is definitely Dhamani, and Roga is Dhamani Pratichaya. Ashtanga Hrudaya, there is a reference on this. Dhamani Pratichaya. TAO or Burgess disease, thromboangiitis obliterans. Yes, this is when both the systems, when you compare Tridosha Prakopakarahara Agnimandya Ama formation, like that, excessive smoking, it does triggers the immunological phenomena, formation of type 1 and 3 collagen, and this obstructs the endothelial vascular blockages, and does finally HLA 19, HLA 54, these are the genetic components to speak, and peripheral vascular impairment and vasodysfunction resulting into Dhamani Pratichaya. We can really, when you evaluate Ayurvedically, you can give all the information on this. And clinical, as I told you, very intermittent pain, color changes, skin temperature, diminished skin temperature, absence of arterial pulsation, nutritional changes, swelling and edema. What happens? If there is an artery, supply diminished, and naturally swelling, ulceration, and gangrene formation. Yeah, well, leech therapy action, local tissue is initiated with the withdrawal of congested and stasis blood. Biological active substance of leech saliva can possess anti-inflammatory, vasodilatation, analgesic property. The existence of demo-visceral connections, see, this is one of the beautiful aspects, skin and visceral connection. You are applying on the skin, but it is able to produce the results on the visceral system, visceral organs. this demo-visceral connection is maintained with the only leeches during the sucking process. Well, probably to speak, a future biocompound of leech saliva, a future biocompound. For your information, I tell you, there is an article, recent article, the leech's saliva anti-carcinogenic properties, people are working on it. Probably we may not get the leeches in the future because the saliva is documented to produce the anti-carcinogenic properties. And see, an attention of the enzymes on the saliva, this could be revolutionary biocompound impact, and the bleeding of Jaluka will stop only after a little time because of the presence of iridine. And there are 36 proteolytic. When I prepared this slide, 36 proteolytic, now more than 100 proteolytic enzymes have been documented. And each proteolytic enzyme is significant to the one pathological diseases. And we have done a Doppler study on the Burgers disease of the lower and upper limb. These results I want to show you. The incidence of affected limb pulse. We have taken the, no, because when I say Bhaskar Rao being in the practice, I have treated 100 cases of Burgers disease, nobody will believe. It is good for self-confidence and other things, but the scientific community never allow you to speak. You can talk the things in your clinic. You can talk to your friends. When you want to talk to the scientific community, you have to document the things. I have moved to Australia 4 times, Japan 4 times as an invited speaker, London twice, and I am scientist visa to the USA. They have actually, my paper was selected 8 years back, SAGES, Society of American Gastroendoscopic Surgeons. My paper on Kshara was selected in America. I have to present a paper. And I applied the visa, thinking friends were telling, no, getting American visa is very difficult. And the organization which invited you to America is one of my modern surgeon friend was talking to me. Getting an invitation to America for SAGES to attending a conference is, we feel privileged. And you are invited to present a paper on the Kshara Sutra, you have to go. Then I applied, I went to the Chennai visa office and they asked me why you are going to America. Then I said, I am not going to America. I am invited by America. And I am not going to America. I am not crazy. I am invited by your country for my lecture. They given me multiple entry visa with the single word. Really, it's not boasting. So confidently, I spoke to the visa officer. Immediately, he gave me multiple visa. Now, 3rd time, I am going to visit. Twice I completed as a speaker. Last year also, Veda Mela, September in the Dallas. And first conference was Houston. So things, and don't worry that you are Ayurvedic or allopathic. You have the stamina, you have the capability, you have the dum in you. You can blast anywhere. The only thing is scientific documentation of the things, modalities are essential. Talking is simple, but documentation, when you can able to produce properly on the modern parameters without compromising the basic tenets of Ayurveda, mana fundamental, mana moolalu chedipokunda, ఆయుర్వేదాన్ని మనం ఎక్కడికైనా తీసుకుపోవాలి. దాట్ షుడ్ బి యువర్ మోటో అండ్ దాట్స్ హౌ యూ షుడ్ వర్క్. మనం మూలాలు వదిలిపెట్టి నేను అల్లోపతికి నేను ఐ విల్ గివ్ యూ ద 3rd generation cephaloxins antibiotics, highest antibiotic. What is the purpose? Anybody, any RMP fellow can use the antibiotics. Avoid antibiotics, give Ayurvedic drug. That is your duty. Talking, no, without compromising the basic tenets of Ayurveda. And you just do it. It's only inspiration matter, not to tell me about me, because I have 25 publications, international documented publications, 4 books, more than 13 countries, multiple visits some countries. So it happens on the practice. Ingokoti anachu endukane Japan ke 4 saarlu poyina 4 saarlu they have given me. It's like one thing is I have a passion of visiting abroad, and I never bothered for money, and within a month I used to get the money. I don't know how. That's what Ayurvedic practice will give you. Don't worry. And open rako, khulla rako, money will come automatically. Never bother for money. The only thing is if you can inspire a future generation like you, my purpose of coming is over. If anybody is able to practice leech therapy from tomorrow onwards, that's it. My purpose is over and I am fine.